Hi everyone. Thank you so much. So I'm excited to present some results from our PAUSE pilot project, or Prescribing Antibiotics Wisely in Animal Shelters. And this work characterized antibiotic prescribing patterns in a large municipal animal shelter between January of 2022 and June of 2025. And this work was a multidisciplinary collaboration across the College of Public Health and Veterinary Medicine. And this work was supported through the University of Arizona's One Health initiative. So, antibiotic resistance develops as a result of antibiotic use, whether that use is appropriate or not. And excuse me, it's a little blurry. And so antibiotic resistance poses a growing risk for human and animal health. And, however, antimicrobial stewardship aims to preserve the effectiveness of these antimicrobial drugs by helping ensure that they are only used when absolutely necessary. And while stewardship efforts are very well established in human medicine and veterinary settings like food production, companion animal shelters are settings that are congregate environments with animals that don't always have access to diagnostics or other resources that often even other veterinary companion animal clinics do. However, they do not have currently any antimicrobial stewardship guidance that supports these shelters in taking into consideration those constraints. And so one pillar of antimicrobial stewardship is to understand and characterize the antibiotic use in these settings. And so what we aimed to do first was to characterize antibiotic use and calculate the days of therapy per 1,000 shelter resident days. We also aim to assess differences in the prescribing of higher risk antibiotics by species. And briefly looking at our sample here, we had just under 60,000 shelter stays for both cats and dogs. We had 25,000 plus antibiotics prescribed during these shelter stays, and they were prescribed to over 15,700 unique animals, made up of 35% of cats and 65% of dogs. And what we saw overall was that 30% of cats and 34% of dogs received at least one antibiotic prescription per shelter stay. We also noticed that dogs experienced more frequent shelter stays per animal, longer shelter stays, more antibiotic prescriptions per animal, and longer antibiotic courses when compared to cats. We were also very curious to understand the most commonly prescribed antibiotics classes per species. And if we turn our attention to the left-hand side of the chart, we see that penicillins were most oftenly prescribed to cats, and third-generation cephalosporins and tetracyclines were more often given to dogs. We also calculated an antimicrobial use rate, which is expressed here as days of therapy per 1,000 shelter resident days. And interestingly, although dogs experienced higher numbers of total antibiotic prescriptions, cats actually had higher amounts of days spent on antibiotics during their shelter stays. So we see here that cats spent 257 on average days of therapy per 1,000 shelter resident days compared to 164 for dogs. We also tracked this trend across the study period by month as well. And then to understand the potential public health implications of these prescribing patterns, we also categorized the antimicrobial prescriptions using the World Health Organization's list of medically important antimicrobials. And this framework categorizes antibiotics based on their importance to human health and the risk of resistance spreading from non-human sources. And so these drugs were characterized as highest antimicrobial risk were drugs that were authorized for use in humans only, and then the lowest risk were those authorized for use in animals only, and then there was kind of the shared range in the middle where the sample lied for this particular study. Specifically, these categories that were represented here are the highest priority critically important antimicrobials, critically important and highly important antimicrobials. And if we turn our attention to the bar chart here, this shows the percent of antimicrobial prescriptions. And we see that just under 30% of dog prescriptions fell into this critically important highest priority category. And however, the majority of prescribing overall for both cats and dogs fell into this highly important, less critical category. We also wanted to categorize the prescriptions using the University of Minnesota's antibiotic drug tiers, and this focuses more on clinical decision support for veterinarians. This guidance is categorized into first-line drugs that are recommended for empirical use, second-line drugs that are reserved for more of bacterial culture and sensitivity indicates that prescription is necessary. Consult is kind of more rare circumstances where they're last line, and then avoid altogether. And so in our sample, we saw that prescriptions fell into the first and second line categories for this University of Minnesota drug tiers, and the results very closely mirror what we just saw in the WHO's categorization, with the 30%, just under 30% of the dog prescriptions being categorized as second line, but the majority being first line. And then to understand these differences better, we used a generalized estimating equations model to understand the risk factors associated with higher risk prescribing. And so first we modeled the odds of being prescribed a WHO highest priority critically important antimicrobial and saw that a prescription for a dog had a 3.58 times the odds of being a critically important antibiotic compared to a cat prescription. And also after adjusting for length of stay prior to prescription and animal years of age, we saw that those odds only increased. And so and we also did the same for the University of Minnesota second line antibiotic tier and found very similar results. So to wrap things up, we found that dogs represented 65% of shelter stays, but more than that in overall prescriptions. Cats spent 56% more of their shelter stay on antibiotics compared to dogs. And we saw that penicillins, tetracyclines, and third-generation cephalosporins made up the majority of antibiotic classes, over 80% for both cats and dogs. And while we were able to assess the antibiotic prescriptions, we were unable to assess the clinical indications for those prescriptions and confirm medication compliance. And so we have a lot of future directions we'd like to take this. For the sake of time, I will skip those. But just thank you so much to the symposium, to our research team, and to our shelter partner.